Welcome to the 707, a weekly half-hour program produced by KRCB, a service of NorCal Public Media. The 707 features voices and stories from your community, stories that reveal the impact of social services, and stories that show how we are connected to each other. I'm your host, Michelle Marques. Face to Face has been doing important work in our community for decades, initially to provide care and services to those living with HIV/AIDS in Sonoma County. Natalie Gospe is Digital Communications Coordinator at Face to Face, and they sum up the mission of the organization today.
Face to Face connects our Sonoma County community to the practical care and support that honors dignity for all.
Part of the services they provide include the distribution of naloxone, a drug that reverses opioid overdoses. Recently, the California Department of Public Health announced that in 2024, Face to Face distributed 44% of the naloxone obtained from DHCS naloxone distribution program in Sonoma County, yet accounted for 66% of the overdose reversals reported. Lorie Violette is Program Director at Face to Face, and she explains the services they provide.
We serve individuals living with HIV with non-medical case management. Looks like a lot of financial assistance, being supportive, help people navigate to other services that they may need or want. And in our prevention program, we do HIV and hepatitis C rapid testing. We have an educational component to that, which is growing, so keep a lookout for us on that. We also have our comprehensive harm reduction program. And we have a mobile unit.
So when you talk about harm reduction, what does that mean?
For me, harm reduction is just showing love and compassion regardless of what people are doing in their lives. We're here as a friendly face to help people be as healthy as they can be.
And what kinds of services do you provide for harm reduction?
So we provide lots of services. We provide naloxone, which is the opioid reversal medication. We provide supplies for people who are using drugs, whether that is new syringes or smoking equipment or sleeping bags, condoms. All of those are harm reduction items. And so we provide a large variety of supplies like that.
So that sounds like you're really thinking about the whole person when you're talking about harm reduction, because a sleeping bag keeps you from sleeping on the ground, right?
Absolutely. Oftentimes people look at harm reduction as being, one thing or associated with one kind of category of people or a population of people. But really, we all engage in harm reduction on a daily basis. And we brush our teeth daily. That's harm reduction. And so, we just want to be able to be a safe place and an accurate place for information and knowledge for people for them to be as healthy as they can be.
When did Face to Face sort of make a transition from being more focused on the AIDS community, HIV, to adding this harm? Well, I guess it was always there, but extending what you're doing in terms of harm reduction.
In 2009, Face to Face began offering rapid HIV testing. And when in 2016, we kind of blossomed into being out and about with our harm reduction, meaning prior to that, we were underground with it. So we were still providing services, but we just weren't advertising that we were providing those services. We currently are very much advertising it and are very proud, as we always been, of the services that we do provide. But we are really wanting the community to be aware of all of the services that we provide, not just including services for people who use drugs or people who are living with HIV.
Was there an impetus that made you decide to be more open about what you were doing?
That's a really good question. I've never been asked that before, but what I would say is this organization has always led with love. And this organization has been instilled in treating people with dignity and respect. And I think just over time, as harm reduction services became more needed in our community and less talked about, we needed to stand up and do something.
So for social media messaging, harm reduction, not everyone is on board with it. People have different opinions about it. So how do you, Natalie, make it accessible, make it open and safe and welcoming for everyone?
Well, we know that barriers are the thing that is putting the health of our community and our individual health at continued risk. So, in addition to harm reduction services that we offer in office being low barrier, I try to make sure that I approach every topic with language that's easy to understand and is compassionate for people who may be skeptical as well as people who may be relying on these services. I think it's important to meet both populations and just present all information so that people are well informed.
You also have to worry about Instagram, Facebook saying, nope, you can't say that. So how do you deal with that?
Mostly, I try to do my best to make sure that I'm using language that's clear, but that is a little less jargony, which does end up being language that is less likely to be censored. If I'm talking about, drug use, I'm going to be saying substance use. And if I'm talking about people living with HIV, HIV luckily is a term that is less censored on social media, but it's definitely a challenge when you're talking about specific populations, especially in the current climate that we're in with so much language being limiting.
Do you do like creative things like, say you're talking about condoms? Like, how do you do that?
Honestly, I find that I try to do my best to work with the language that is the technical terminology, that is what people understand, because people will engage with it. And the algorithm does indeed prioritize engagement even over topics that are riskier. That's why we're fed all of these intense topics that are going on politically right now, because the algorithm does thrive on people actually saying what's happening and the response.
Do you often get pushback from the different platforms?
Occasionally we do have some of our videos that get censored or deleted, but more often than not, I'm really surprised at what we are able to put out there. Occasionally we will get some negative comments from people, but it does become a learning opportunity and to really engage with people on the point that is most contentious for them. We can have that conversation then.
What's the most viral that something has gone for you?
I think our most viral video, I'm very proud to say, is actually just a basic HIV 101 video. I'm so proud of the fact that we're able to produce that information and have it be out there in the world, because HIV is still here. And I think more and more that we exist in this digital space, we're forgetting the physical spaces where the HIV epidemic really took place in, and it still is around. So to be able to communicate in the digital space, meet people there, really has the opportunity to influence the physicality of HIV risk in their lives.
Can you tell me about messaging around naloxone, around harm reduction, fentanyl use? How do you approach that?
I definitely try to approach it clinically, but of course with accessible language. I know that I really keep strictly to using the term naloxone over Narcan because it is a medication, and keeping it to the actual tool itself versus the branding really focuses on the actual issue that it is helping to solve. Yeah, I think I just keep things pretty straightforward to what actually these tools are used for. You don't have to deal with ideology if you're meeting people in the ideology of it.
That's a quote right there. Dang, write that down.
Right.
That's incredible.
Natalie is awesome. They do an awesome job at what they do, and yeah, we just adore them.
Yeah. I'm a fan too, and your pieces are really entertaining too. So, tell me about your process of putting together your social media, because it's. I mean, you really see your intent in them. They're very entertaining and educational.
Oh my gosh, thank you. Well, in terms of process, I mostly try to assess what will be most attentive to current community needs. So I'll typically ask around other staff members. I'm also a member of our prevention team so that I can be involved in community outreach and really get a sense of, okay, right now people need to hear about fentanyl test strips. Right now people need to hear about HIV testing. And so once I've got that information, I will write up a script, I will research it and try to make sure that I am sharing the sources online that I'm using. Especially in an age of misinformation, it's really important to know where the information you're learning is coming from. So I look for reputable sources, and then I share with other staff members the script that I've written and check in with people. And then I film it, edit it, and post it on our social media. So that's my process.
Are they filmed here?
Yes, they are filmed right upstairs.
Oh, neat. Okay.
Right here in office.
Okay.
I have definitely a makeshift studio set up just in my office upstairs. I have that lovely bookcase that's behind me when I do a lot of my educational video content. I put that there so it can become a conversation piece. If you're looking at this and you see there's a model of the T cell when it's impacted by HIV, and if someone goes, "What's that?" then I can do a video on that. And so I've got this set up. I've got just honestly some makeshift lights. I have a background in video production, so I just kind of, in a lot of ways of how our services work, just made do with what's available to provide people with the information and services they need. So that extends into the process of the production.
Distributing naloxone and other harm reduction supplies to a county as geographically spread out as Sonoma County takes a lot of work. Face to Face uses a mobile van to serve the greater community.
In 2022, we began doing some fundraising because we knew that our mobile services were needed. This was one of the silver linings that came out of the pandemic. People needed our services to get to them where they were. In 2023, we secured this mobile unit. We had it retrofitted to fit the needs of what we were wanting to do with it, which is provide our services. Anything that you can get in-house, you can get on that mobile unit. Our unit is out and it goes to 12 different locations throughout the week. Some weeks are higher than others as far as locations, but we're definitely trying to make a big impact with the people that need our services.
I'm talking with Natalie, Gospe, and Lorie Violette of Face to Face. You're listening to the 707 on KRCB. We'll be right back.
KRCB is Sonoma County's NPR station, featuring the voices, sounds, and culture that make our home unique. From the heartwarming tales of postcards,
our grandmother was the founder of Juneteenth in Sonoma County,
to the Arts Briefs series shining a spotlight on the incredible youth in the arts scene.
Mariachi can express everything that you feel.
And farm tales.
We live in this beautiful area that allows all forms of success in agriculture.
Your stories, your station. KRCB 104.9, Sonoma County's NPR station.
Welcome back to the 707 on KRCB. I'm your host, Michelle Marques. Face to Face sent out an email announcing the impact they've had. In 2024, 2 out of every 3 overdose reversals in Sonoma County were credited to the naloxone distributed by Face to Face. Program Director Lorie Violette says they were humbled by the news.
The California Department of Public Health, the Office of AIDS and Harm Reduction Unit, that's a whole mouthful, we're very connected with them with the work that we do. And they just reached out and gave us this information and said that it was very interesting to them. They thought it would be very interesting to us, and they wanted to share what they found out. Just seeing those numbers on paper and then just being able to absorb and think about what that actually means in our community with a staff of 13 people, it's just amazing. But I do want to just say that we did not do this alone. This is a community effort. We provide naloxone to a lot of service providers that then provide it to folks that need it. We also have vending machines throughout our community that have naloxone available in them, as well as fentanyl test strips. Yeah, and we just have no barriers to people accessing naloxone of any amounts. We do not have limits on what people, if they ask us for 5, we're going to give them 5.
When we talk about using naloxone, that is something that you are educating people on social media. You're educating people here at Face to Face when you're out and about. How important is that aspect of it? Because it's not just sort of you take it once and then everything's rosy, right? I mean, there is sort of follow-up care and all that kind of stuff. So how do you get that message out?
Well, besides our social media and in-office education that we do, we also do educational trainings out in the community. We provide overdose reversal and response trainings that educate people on basic drug education, as well as talking about what naloxone is, how you use it, what's actually happening in the brain when an overdose is being reversed, so that there's all of this context to understand how to give a compassionate response to somebody who's currently experiencing what is very much a medical emergency.
Knowing how to use it is super important. And so I'm really glad that you touched upon that, because you can have naloxone in your hand but not know what to do or know how to recognize or know how to support after naloxone is given. And you can actually cause more harm. Mm-hmm. So we take pride in educating people at their level on what that means. Our participants educate us. We get firsthand knowledge from the people we serve. They're the experts in their lives, not us. So credit needs to be given to the people who are receiving our services.
And so the feedback that you get from people who maybe came in, they got some test strips, they got some naloxone doses, and do they come back and say, wow, I saved somebody with this? Do they tell you about that experience?
Absolutely. We hear it daily, maybe several times a day. And we actually, unfortunately, have had to use naloxone here on site with folks, in our vicinity of our agency. But we're glad we have it on site. We're glad we're able to use it and we're able to respond, and we're saving lives.
Face to Face works in partnership with the Santa Rosa Police Department to distribute naloxone. Here's Lieutenant Christopher Mahurin.
I was actually on the board for Face to Face for 6 years. And so I've been a police officer with the department for almost 20. And so while being on that board, I saw there was a good opportunity for partnership, for working with a vulnerable community that oftentimes kind of goes underserved and oftentimes can be overly criminalized for behaviors or addiction. And oftentimes we will get phone calls and hear about areas that we see higher usage of drugs or needles in particular or overdoses. And our organization is able to partner with specifically Lorie over the years of saying, hey, this is what we're seeing in the community, and these are the calls that we're also getting. And Lorie is then able to go out and provide outreach and services to those communities, whether that's helping with needle exchange or providing resource information for drug or alcohol education or services to kind of help with those issues has been really key. Over the years, we've also shared stock supplies of naloxone. Every officer in the department, especially in the field, carries naloxone with them in case there is an overdose of a community member or of an officer. And because naloxone does have an expiration date, just like most medications do, we were finding that we don't use it nearly as much. So usually in that 6 to 8 months before ours is going to expire, we're able to share that supply back to Face, so that way they can actually get it to their clients who have a higher propensity to use it and make sure those supplies don't go unused or just destroyed because they've expired. So it's been a way to share resources between a government agency and then also a nonprofit as well.
Mahurin says that opioids and fentanyl are still significant issues in our community.
We've seen a huge increase in that over the last 6, 7, 8 years in particular. When I was a young cop, they would tell us that you're never going to really find any sort of like heroin or opioids on individuals because how addictive it is and how quickly people use those. Nowadays, we are seeing that as one of the primary uses of narcotics or drugs, in particular things like fentanyl. A lot of our other narcotics that we see on the streets, whether it's methamphetamine or other things, we are finding when we test them that they also have traces of opioids on them or in them. And oftentimes that's what we're finding is really making people overdoses, not knowing that whether it's crystal meth or other things actually have that laces of fentanyl or other opioids, and that's what's actually causing the overdoses on folks. So we are seeing a large increase still year over year of those kinds of narcotics on our streets, but we're seeing better people having things like testing strips when they're using narcotics or other things to reduce the risk of overdoses as well.
He says that the compassion Face to Face shows to their clients helps his officers approach people in crisis with greater understanding.
I think the compassion and empathy is kind of increased when people understand what's leading to drug addiction and substance abuse addiction. I think when you understand where that's coming from, rather than making generalizations about people, it really does humanize an impact on an individual rather than just saying, hey, this person's a drug user. No, this person has a substance problem. How can we help them with that, and what services do they need? And is that part of the reason they're doing what they're doing? And how can we help the core issue rather than just criminalizing a single action? So I think that, that has really changed the perspective, at least for our agency.
Lorie Violette says this partnership with SRPD is important and rare.
I know there's a lot of controversy about like harm reduction and police and like that type of thing, but honestly, we in our community don't really have that issue. We're very fortunate that we do not have that issue. We work together. They have their job and we have our job. We may not see eye to eye on everything, but that doesn't matter. That's what makes the world go around. I've known Christopher for many years. He's definitely a huge supporter of ours and understands the work that we do. And yeah, I wouldn't change that for anything. I've actually had other syringe service programs or harm reduction programs ask, how do you get along with your police? And, I couldn't write a script on how we did it. It just kind of happened naturally.
I just wanted to say that to reverse an opioid overdose, you'll want to make sure that you lay, spray, and stay. First, you'll want to lay a person down. You'll want to have their head tilted back so that you can insert the naloxone nasal spray into either one of their nostrils, press down the plunger to administer 1 dose. You'll want to stay with the person and administer rescue breaths. You or another person should call 911, let them know that you see somebody who is unresponsive, and when the emergency personnel arrive, be sure to let them know that the person has overdosed and you've administered naloxone. You can give rescue breaths by taking 1 breath for yourself and 1 for the person. You should see their chest rise and fall. Wait 2 to 3 minutes before administering another dose of naloxone. And naloxone does indeed only have an effect on the body for 30 to 90 minutes, so stay with the person because there is a chance that they could go back into overdose.
Learn more about Face-to-Face and the services they provide at f2f.org. I'm your host and producer of this program, Michelle Marques. This show is a service of NorCal Public Media. Our president and CEO is Darren Lachelle.